so I'm going to demonstrate a supine occipital lift, a bit different than the one that I've shown before, and I will show that variety in this class as well. The typical supine lift that I usually demonstrate involves holding on to the chin, right? And there are occasions where you may, even though you're not really putting any type of stress into the TMJ, there may be times where the patient has sensitive TMJ, or there is a TMJ issue that you want to just avoid any problems that could occur with this type of delivery. So we're going to just do a variation of that adjustment without using the wraparound on the mandible. So let's just review the assessment for the coupled motion here first. So the assessment for the coupled motion starts off with retraction. So we're going to lower the headpiece a little bit. And the reason you want retraction is because you want to see if there's anterior sagittal glide. So if you're not retracted to begin with, you're not going to be able to feel if there's any anterior sagittal glide. So we retract, and we do that by holding on to the top of the head and just pushing down and forward slightly. And then we isolate the movement to the top, right? So lateral bending to the top, a little rotation of that nose back to the midline, and then apply overpressure in that manner. And the overpressure is equal through both hands, and it's kind of aimed down towards the shoulder. What I see a lot of docs do here is they try and purposely create that anterior sagittal glide. You don't have to do that. It'll occur anyway, just based on the shape of the COC1 facets. So if you start off with some good retraction and lateral bend and just a little bit of rotation, and then just symmetrically push on top of the head, you'll feel the give and you'll feel some of that anterior sagittal glide. And of course we'll perform this on both sides to compare the right with the left. So again, start with some retraction, bend it over, rotate the nose back to the midline, and then apply that pressure. And it just turns out that there's a little less movement the first way I did it to the right, which works out great for the camera. Now I don't have to change anything around to get this view. Okay, so here's the adjustive setup. The hand that would normally wrap around the jaw is just going to make a very broad spread out contact on the side of the head. So just put the ear right in the cup of your hand. Leave a little, if you open your hand up wide, it creates a natural little cup in there, so you won't suction the ear, and then spread your hand out over the entire side. And then rotate the head till it won't rotate anymore. The lateral bending for this adjustment occurs from the position of the headpiece. So if you want a little bit more lateral bending, just raise the headpiece up a little bit to give you a little bit more lateral flexion, because you're not going to impart lateral flexion into the adjustment. The contact is the same for both adjustments. There's a demonstration of this adjustment in this channel as well you can refer to. So the mastoid is the contact, right? And what I'll do is I'll place the softest part of my hypothenar up on the mastoid and come from below so that I don't scrunch the ear. I don't want to end up scrunching the ear, and I want to stay off the mandible. So here's the back of the mandible. So I just stay just behind it like that. And this adjustment is accomplished by using both hands equally, right? And imparting a little bit of a rotational component, almost like a little bit of a corkscrew at the end. Right? So I'm actually going to stand a little bit to give myself a little closer to where I'm delivering the adjustment. So everything's in place, and I'm very, very relaxed. All right, very, comfortable. I'm not imparting any more movement to it. And from that relaxed position, I'm holding on to my patient with both hands, and then the adjustment comes from that explosive HVLA with that little bit of a twisting motion to it, just like that. Right, and there's the adjustment. High velocity, low amplitude, HVLA, force generation. All right.